from skin to the superficial part of the liver or organ. LP needle of 18 gauge is introduced into the cyst under direct vision of the ultrasound. Cyst fluid is aspirated with a 50 cc syringe, and as much as possible can easily be aspirated is aspirated. This is the cyst, and the needle is being introduced and is forwarded and aspirated, and gradually the cyst becomes empty. This is the pair procedure of a splenic hydatid. Another case of a liver hydatid, partly responding to the treatment. Partly the membrane is collapsing inside. That is the membrane floating water lily sign. Then injection is made. 20% saline is injected into the cyst, equal to the half of the aspirate. Needle is left in situ for another 30 minutes. There are other options reported in the literature, that is 30% saline, alcohol, silver nitrate, praziquantel, formalin, ivermectin, albendazole, citrimide, hydrogen peroxide, and povidone iodine. People have been using all of these, but my experience is limited to hypertonic saline only. Hydatid cyst after the hypertonic saline. You can see the membrane collapse. After 20 to 30 minutes, all the fluid which can be aspirated is taken out, and then needle is taken out. This is the picture before the pair procedure and after the treatment. This is a solid looking hydatid on the liver edge. This hydatid cyst was very near to the gallbladder, and sometimes if there is some leakage of the bile there, then another procedure is performed, that is called PEVAC, or percutaneous evacuation of the cyst contents, or percutaneous drainage pair PD, or modified pair for echinococcal cyst with cystobiliary fistula. That's a video clip of the procedure. That is the hydatid cyst in the liver. It's being measured. I'm looking for the spot to go in. Soon you will see the needle. Safest route is chosen where we don't want to go into any important structures or liver vessels, etc. This is the needle, the shining line within the cyst. Aspiration is under process. Sometimes that membrane and solid contents hinder the aspiration, and then we may have to readjust the needle and suck out the fluid as much as possible. This is the saline being injected, hypertonic saline, and that turbulence creates, that turbulence can also be seen on the Doppler. Hypertonic saline. and some of the air bubbles which came in. Another video clip. Sometimes such unilocular cysts are difficult to distinguish from other simple cysts. You have to look for the double wall sign. The wall of the hydrated cyst is always very well demarcated. That was the needle. Here. The aspiration is under process. Okay. Response to the treatment is monitored by the changes in the cyst, complete disappearance of the cyst, cyst size reduction, membrane detachment, increasing echogenicity and calcification. Liver hydrators after treatment. Solid looking lesion. Congealed water lily sign or a Band Gobi sign. Solid looking hydrators after treatment. This is after 2 years of pair treatment. There is almost a solidified type of lesion. Patient didn't have any symptoms after the procedure. This is a hydrated cyst, unilocular looking, quite large. When I enlarge the picture, zooming in, you can appreciate the double wall here. In this view, it looks like a simple cyst. But as you go on to have a closer look, you will see that it has got a double wall. One of the host reaction, one of the cyst, the double wall sign, the double wall. It can be appreciated at certain angles and with enlargement. This is a fairly recent patient that I got, and patient is on albendazole. Before the albendazole, it was just a unilocular cyst like this. Note the date, 8 June. And now 7th July. The membrane has started collapsing. We'll do the pair procedure later on. Another patient, hydrated cyst, fairly frightening look. Can be confusing sometimes, but you have to look for the wall. Side effects reported in the literature. One of the patients developed fever, and this is the list of other problems which arise. And through internet search, I could find urticaria, anaphylactic shock, fever, biliary fistula, infection of the cyst cavity after pair PD, and subcapsular hematoma. These are the results. Concentrate on this one. The long-term result of the percutaneous liver hydrated cyst treatment accord with the short-term result, indicating that the procedure is efficient and safe and offers complete cure in selected patients with a short hospitalization. Okay. If I have time, I can move on to differential diagnosis, or I can stop here. Okay. Differential diagnosis in ultrasound appearance. Simple liver cysts have thin wall. The liver abscess, the wall is usually not very well demarcated. This one is associated with pleural effusion. The liver abscess, irregular wall, pleural effusion, irregular wall, Wall is not very well demarcated. Irregular thick wall, not sharply demarcated. Multiple liver abscesses. Again, the wall is not prominent. Poorly defined walls. The liver abscesses. Chronic liver abscess can become well localized, but still the wall is not that bright or as of the hydrated. This is a hemangioma with the feeding vessels here. The liver malignant masses have got irregular shapes and have got the peripheral halo around these, typical of the metastatic lesions. Liver metastasis, halo around the malignant masses, and Doppler vascularity within and around. A well localized mass in the lower pole of the kidney has got vascularity inside as well. Patchy fatty liver chains has got the geographical type of margins, but the vascular contour is preserved. Outer contour is preserved. This is an appendicular abscess. The hydrated, there will be no blood flow within the hydrated. This is a gallbladder, the wall of the gallbladder, and there is a stone in it. This is a porcelain gallbladder. The wall seen on the CT and the plain X-ray. Thank you very much.
Any questions?
It didn't require any hospitalization, just one day. It's a daytime procedure. Patient went home in the evening, and my cases were straightforward. There was no complication except one patient who reported on third day that she has got fever. That settled with paracetamol. Not given.
Have you seen any case presenting an obstructive jaundice and CVD was filled with hydrated?
Haven't yet,
Yeah,
but have seen the reports.
Yeah. But we have seen a case when the whole of the CVD was filled with hydrated, resulting into the obstructive jaundice, and this, we thought clinically that it's a mass, but it was when operated, they saw the hydrated coming out, and the surgeons kept on washing it, the thousands of hydrated were there. Okay, so now we disperse for the tea break, and the tea break is for 15 minutes. After that, another session will start. Thanks for your patient hearing and kind attention.
We are the sole agents for Medison ultrasounds. Our head office is in Karachi with branches all over Pakistan. We would like to present a presentation on 3D live images. Thank you very much.
Sound